My name is Melissa Adams VanHouten, and I am a gastroparesis patient and advocate. I wish I could be there in person with you today, but since that's not possible, given the constraints of my illness, I am thankful to be able to join you in a slightly different manner. I would like to express my gratitude to everyone in attendance today, and especially to Miss Mary Angela and the AGMD for giving me the opportunity to participate in this conference. I'm going to talk briefly today about my personal journey with gastroparesis, some of my experiences in the online support groups, and my work as an advocate. It is my hope that this will, in some small way, help those of you who are trying so hard to be heard, and to inform those kind souls here today who are willing to listen. As far as my personal story goes, I was diagnosed with gastroparesis in February of 2014. My symptoms literally came on overnight. One day I was fine. The next morning I awoke to nonstop vomiting and excruciating stomach and abdominal pain. I went to the ER, was admitted to the hospital, and was diagnosed with gastroparesis after about a week's stay. I consider myself fortunate to have been diagnosed so quickly because some in my community spend weeks, months, sometimes even years trying to get an accurate diagnosis. What is less fortunate is that upon my release, I was sent home with very little information about my condition. I had no detailed diet plan, no medications to try, and really no idea what to expect. So I went home, believing my condition would improve, but instead it deteriorated very quickly. Within a couple of days, I was vomiting again, and my pain was even worse than it was before. I was so weak that I honestly could not lift my head up. I told my family goodbye, and I honestly believed I would die. I didn't know what to do. I finally got up enough courage to call my doctor and told him that despite the risks, I thought we should try one of the few available medications. He agreed, but due to FDA restrictions regarding my particular medication, it was 2 long weeks before I could start it. Without a doubt, the 2 longest weeks of my life. Since starting the medication, I no longer vomit for the most part, but I have pain every single time I eat. It is clear to me that this is a life-altering condition, and that I will likely never be able to eat normal food in normal amounts again. I have experienced levels of fatigue I previously thought impossible, unfathomable pain, and I have experienced the horrors of hunger and malnutrition. I had no idea I would face this. My search for information about GP led me to the internet, and it's there that I found the online groups that have opened up such a wealth of information and support for me. Today, I am an administrator in several of these groups, and it is difficult to describe the overwhelming hardships that I see people struggle with every day, things I could have never envisioned. There is physical agony beyond compare. Those in my group struggle daily with tremendous pain and nausea. They are in and out of ERs and hospitals. They are forced to suffer through seemingly endless medication trials, surgeries, and procedures. Many receive good care, but others are at times mistreated by those in the medical community who lack knowledge, understanding, or the will to help. I have read stories from group members who cry out in agony, lying in a hospital bed, being denied pain medications, and being told by their doctors that there is nothing else that can be done. Their pleas are ignored, mocked, and fall on deaf ears. They are made to feel humiliated, treated as hypochondriacs and drug seekers, and are turned away without receiving any help or without any guidance on where they might go for assistance. I see the anguish this causes both the patient and their loved ones. I am thankful I have a physician now who is willing to listen to my concerns and partner with me in evaluating treatment options. He genuinely cares. But that is not the case for many in my gastroparesis community. They remain lost and confused, as I was immediately upon diagnosis, and they never find that competent, compassionate doctor. In addition to the physical struggles, there is also tremendous emotional turmoil. Many in my groups have no one. Their family members and friends alike have deserted them, and they battle alone. There is no one to take them to medical appointments, no one to help them complete the household chores and run errands, no one to talk to them or hold them, and no soothing touch at the end of the evening. That is a huge burden to bear, and no one should ever have to live that way. On top of this, they have financial hardships as well. Many are unable to work due to the effects of this illness, and either do not qualify for disability, or if they do, must wait years to be awarded any funds. And all the while, the medical bills and cost of living escalate. Even those who have an income-earning spouse face these mounting medical costs, and there are no easy solutions to these problems. So I ask myself, who can help these people when they are too sick to work, lose their jobs, their cars, their homes, and everything they've worked so hard for? Where are they supposed to go when they have no income and no family to lend a hand? I have no answers to this. Pain, loneliness, hopelessness, despair, and death. That is what I see on a daily basis. My heart breaks for these people, and I wish so badly that I could change their situation. These are the reasons I believe so strongly in the value of advocacy and spend my days seeking to educate and empower our community members to stand up for themselves and for others. To begin with, I encourage self-advocacy. Self-advocacy means being knowledgeable about our illness and being willing and able to communicate our needs, desires, and goals to others. It means making responsible choices and taking control over those aspects of our care that we can control. It means learning to say no to the things that will negatively impact us and demanding the things we know to be beneficial. It means partnering with our doctors and others to create mutually satisfactory treatment plans. It means shared decision-making, and it means being an active rather than passive participant when it comes to our own care. It means mostly that we value ourselves and believe that we deserve to be treated with dignity and respect. On a community level, it means uniting to promote awareness, better education, and changes in legislation and policies that impact us. It means joining together with others in a common effort and informing, supporting, and encouraging each other in the push to be recognized and to create positive change. And on a personal level, advocacy means to me inspiring others in the gastroparesis community to fight for themselves and to believe that they deserve to be heard, that their plight matters, that they matter. If I could pass along any message to those in my community who are hurting so deeply and struggling, it would be to tell you that you are not failures because you have been afflicted with a chronic illness or because people do not understand the difficulties of living with a devastating condition such as gastroparesis. I see so many people who believe themselves to be worthless because of what this illness has done to them. But you are not worthless. You are valuable. And I want so badly for you to see that you should demand better for yourselves, that you should never be ashamed or embarrassed or feel guilty because of an illness beyond your control. You do not deserve to be treated harshly or unkindly, and you have every right to stand up and speak up for yourselves. I wish with all my heart I could give you all the courage and confidence to do this. Give yourself some credit. You are surviving this horrendous illness despite all the hardships. You are fighters. You struggle with family members and friends who often do not understand. You face a medical community that has no answers. You wrestle with insurance companies that deny you basic, necessary treatments, and you combat the media and general public who have no idea what you contend with on a daily basis. You are sick, and you are doing the best that you can. You have nothing to feel guilty about, and you do not have to apologize for your illness and the limitations it puts on you. What you must do is stand up for yourselves. Educate your family, your friends, your doctors, the media, and the public. Do not tolerate mistreatment that you do not deserve. Be proud of yourselves and what you are accomplishing simply by enduring this disease. You are worthy of love, respect, dignity, and understanding. Demand it. Demand it. Thank you for taking the time to listen. I am grateful for all of you who are here today, you who are initiating the changes we so desperately seek, and who understand our need for awareness, better treatments, and ultimately a cure. Thank you.